Assalamu alaikum. My name is Zobia Jabbar and my registration number is 2K24AB265. I'm a first year DVM student. This is an assignment about veterinary anatomical directional terminology assigned by Sir Dr. Noor Samad. Now introducing the veterinary anatomical directional terminology. Veterinary anatomy directional terminology is a standardized way to describe the locations and positions of structures in an animal's body. Since animals have different body orientations, quadrupeds versus bipeds, their anatomical terms can vary from those used in human medicine. Understanding these terms is essential for clear communication in veterinary practice, surgery, radiology, and physical examination. Now let's talk about the key directional terms. First of all, there is cranial or anterior versus caudal or posterior. Cranial or anterior. This term, derived from Greek word for skull, cranion, indicates a position or direction towards the head. In special cases in the head, the term rostral is used instead of cranial to avoid confusion. For example, the neck is cranial to the shoulders. The second is caudal or posterior. This term, derived from Latin word for tail, cauda, indicates a position or direction towards the tail. Hips are caudal to the ribs. In second, there comes rostral versus caudal. These terms are specific to head. Rostral, derived from the word rostrum, that means snout, refers to the structure closer to the nose. And caudal. In the head region, caudal still means towards the back of the skull. For example, the eyes are rostral to the ears while the brain is caudal to the nose. And third, there comes dorsal versus ventral. Dorsal, derived from the word dorsum, that means back, refers to the structure located towards the back, top in quadrupeds. Ventral, derived from the word venter, that means belly, refers to the structures located towards the belly or underside. For example, the spine is dorsal to the stomach while the udder is ventral to the backbone. Medial versus lateral. Medial, derived from the word medium, that means middle, refers to the structure closer to the midline of the body. Lateral, derived from the word latus, that means side, refers to the structure farther from the midline. For example, the heart is medial to the lungs, while the ribs are lateral to the spine. Number 5. Palmar versus plantar, used for the limbs below the carpus and tarsus. Palmar, derived from the word palma, that means palm, refers to the back surface of the front limb, like the palm of a human hand. Plantar, derived from the word planta, that means sole of the foot, refers to the back surface of the hind limb like the sole of a human foot. Longitudinal versus transverse versus sagittal planes of the body. These terms describe different anatomical planes used in imaging and dissection. Longitudinal plane runs along the long axis of the body or limb. Transverse plane divides the body into cranial and caudal parts. Cross section. Sagittal plane divides the body into left and right parts. Mid-sagittal plane or mid-sagittal medial plane divides the body into equal left and right halves. Parasagittal plane divides the body into unequal left and right parts. Peripheral versus central. Peripheral, derived from the word peripheria, that means around the outside, refers to the structure away from the center of the body or organ. Central, derived from the word centrum, that means middle, refers to the structure towards the center of the body or organ. For example, the brain is central, while the nerves that extend to the limbs are peripheral. Proximal versus distal. Proximal, derived from the word proximus, that means nearest, refers to a structure closer to the point of origin or attachment to the main body, used mostly for limbs, tails, and other appendages. Distal, derived from the word distere, that means to stand apart, refers to a structure farther from the point of origin or attachment to the main body, opposite of proximal. For example, the shoulder is proximal to the paw is distal to the elbow. Axial, derived from the word axis, which means central line, refers to the head, neck, vertebral column, ribs, and sternum, the central axis of the body. Appendicular, derived from the word appendix, which means attachment, refers to the limbs and their attachments. For example, the skull is part of the axial skeleton, while the femur is part of the appendicular skeleton. Axial versus abaxial. Specific to digits in animals like horses and cattle. Axial, derived from the word axis, which means central line, refers to the structure closer to the axis of the limb or digit. Abaxial. Ab means away from axis, refers to structure farther from the axis. For example, the inner side of a horse's hoof is axial, while the outer side is abaxial. Understanding directional terminology in veterinary anatomy is essential for accurately describing the position, orientation, and movement of structures within an animal's body. These terms provide a standardized language that allows veterinarians, researchers, and medical professionals to communicate effectively, ensuring precise diagnosis, treatments, and surgical procedures. Unlike human anatomy, which uses terms like superior and inferior, veterinary anatomy relies on cranial, caudal, dorsal, ventral, medial, lateral, proximal, and distal to describe positions relative to the animal's body structure. Additionally, specialized terms like palmar, plantar, axial, abaxial, superficial, and deep further refine anatomical descriptions, particularly in different species. By mastering these terms, veterinary professionals can enhance their understanding of anatomical relationships, improve their ability to interpret medical images, and ensure clear and consistent